What's up guys, welcome back to another video. Today's video is all about me reflecting on my 1 year practicing as a nurse practitioner. I am going to be sharing with you guys my lessons learned so far, my biggest regrets, and also a little bit of advice if you are aspiring to become a nurse practitioner, you're in nurse practitioner school. Hopefully this will teach you something, and yeah, let's get started. I'm gonna just go make my coffee because we're just gonna be chatting over my morning cup of coffee. So let's do that and get started. The biggest lesson, and I'm not even sure if this is a lesson, but the biggest thing that I have learned or I had to wrap my mind around was the fact that I am no longer the person taking orders. I am now the person giving orders. And honestly, it's a big deal. It's a big thing to get your mind wrapped around. When you are the nurse, you are the person taking the orders from the providers, from the doctors, the NPs, the PAs, and carrying out those orders. Now you are the provider and you're giving the orders. And I found that when I first started out, I was nervous about this because I thought to myself, one mistake or one wrong move can negatively impact a patient. And I really had to get my mind wrapped around that because it is scary. I remember when I first started, I was so nervous. Oh my God. I was so nervous to change a patient's blood pressure meds. I was afraid to change their insulin. I was afraid to change anything. And yes, I know that there's guidelines for everything that we do, but I was still nervous about it because I had to constantly think to myself, okay, Laurie, whatever decision you say, the nurses are going to do this, and trust and believe something goes wrong. Guess what? The NP told me to do it. Trust and believe that is what is going to happen. So I really had to get my mind wrapped around this. And you know, I worked as a nurse. I had contact with nurse practitioner. If you are working as a nurse, if you have not had any contact with a nurse practitioner, you probably will some point in your career. And if you're making the decision to go back to school to become a nurse practitioner, you know what the nurse practitioner role is. Us nurse practitioners are providers. We are authorized to diagnose, treat, and write prescriptions for our patient. If you're going to go back to school to become a nurse practitioner, you do know what the role is, but knowing it and doing it is a big difference. Honestly, it is a big difference knowing that you're going to have to do this and carrying out it and doing it. It's going to be definitely scary and nervous. Well, it was for me. I don't know about anybody else. Now, the next thing is I really had to be okay with the fact that sometimes I'm just not gonna know. Period. Plain and simple. Sometimes I'm just not going to know. When I first started working, I work mostly in primary care, so I see patients mostly in the nursing home setting, and nurses will call me for whatever reason. Something is going on with a patient, they're calling me. This is what's going on with the patient. What do you want to order? And sometimes I didn't know what I would do. I would just say to the nurse, you know what, I'm busy right now, I'll call you back. And I would feel so bad. Oh my God. I remember I used to feel so incompetent, like, why you don't know this? And I used to beat myself up a lot, like, you should know this. You're the NP, you're the provider. Why don't you know this? But at the end of the day, listen, let me tell you, at the end of the day, the physicians also don't know it all. So it is okay for you not to know. And I'm telling you right now, you're going to probably call the stupid NP, the NP that don't know nothing. But guess what? Do not make a decision and give an order because you want to look like you know when you don't know, because that in turn will affect your patient. So if you have to tell them, listen, I will call you back, half the time it's not a life or death situation. Tell them that you'll get back to them and you do your little research and then you get back to them and order and do what it is that you need to do. And listen, I know nurses can be very pushy. Trust me. I didn't realize how pushy us nurses were until I was in this role. Nurses are so demanding. We are like, I need this doctor to order this right now. Nurses are so pushy, and don't let them strong arm you into ordering things and doing things that don't make sense, number one. And number two, it's not necessary for your patients, because I remember a nurse calling me one time telling me to order Lasix for a patient. So I said, why should I order Lasix for my patient? She said, because the legs are swollen. Well, ma'am, we can do a whole lot of other things than Lasix for this patient. I'm not going to just throw this patient on Lasix. What is the kidney function? What is the BUN? What is the creatinine? And I'm pretty sure I was called every BICTH under the sun, but guess what? These are examples that I'm giving. Don't let them strong arm you into ordering things and doing things that, number one, don't make sense or is not necessary for your patient until you do other things. So these were things that I really had to overcome, and I had to own into myself and say, no, I'm not doing that, and it is what it is. So those are the two biggest lessons I think I've learned so far. And 15 months in, I'm a little bit more sure of myself. Of course, there are still days that I don't know and I have to go look it up. I have to go research. You're still going to be learning. I would text my boss and say, hey, this is going on with my patient. What do you think? Now, one of my biggest plus of this job is the fact that I am a part of the decision-making team. And the reason why I say this is because I feel like patients respect the white coat. Patients respect the white coat. Whether you are the MD, the PA, the NP, whatever, the DO, patients respect the white coat. And they will more than likely, not all the time, but more than likely, they will listen to you and go with what you're saying and take your suggestions more than they will if you're not wearing the white coat. Now, when I was a nurse, and let me know in the comments if this happened to you when you were a nurse. When I was a nurse, a lot of times you'll go and you tell patients something, or you'll teach them something and educate them about something, and then they'll be like, oh, nope, don't go like that. Nothing like that. I'm not doing that. That makes no sense. And the white coat walks in. The white coat walks in. When the white coat walks in and tell them the same thing, you're at the door because you're listening, and they're like, oh, nobody's told me this before. How comes nobody has ever told me this before? Really? Mr. B, I told you the same thing a minute ago. The same thing. So that's why I said patients a lot of time respect the white coat, and I feel like I'm in a position now where I'm wearing the white coat, but I am a nurse at heart, and I can teach a little bit more, and they'll listen a little bit more, and they'll take to what I'm saying. So I am in a position where I can teach my patients, and a lot of times, trust me, patients need to be taught a lot of things. Don't assume that a patient understands what you're telling them. Don't assume. Even sometimes when they say don't talk in medical terms and you talk in layman's term, you need to talk in less layman's terms for some patients. Trust me, I have seen it. Now, my biggest regret is becoming a family nurse practitioner. Not that I am a nurse practitioner. I really truly love being a nurse practitioner. If you didn't watch my nursing story and all that, check it out. My background is ICU. I started off in the ICU. I am an ICU girl at heart. I love the hustle and the bustle and the rush and the intubation and the A-line and the chest. Like, I love it all. Like, I worked in the medical surgical ICU and pretty much trauma. I love it. And then I decided to go back to school to become a family nurse practitioner. Why did I do that? Long story why I chose family NP. I'll tell you guys later on in another video, but I really should have chosen acute care. I find that my family NP is limiting me to what I really want to do and kind of work in a hospital setting, because most of the hospitals are not hiring me with a family degree. The trauma department will, the ER will. I have no interest in working in the ER. Trauma, how much trauma job do I have? One of the tips that I want to share with you is, if you are thinking about becoming an NP, make sure whichever one you choose is going to align with what you want to do in the long run. The next thing that I definitely want to say is, if you are a nurse and you are thinking about becoming a nurse practitioner, Do not graduate from nursing school today and seek to go to NP school tomorrow. I don't think that's a good idea. And that is just my advice. I don't think the idea that you graduate from RN school today and then literally once you pass your NCLEX, you're looking into applying to go to school to become an NP. To me, it's not going to do you a lot of justice. I feel like you should work a year or two as an RN and get some clinical experience before you embark on becoming a nurse practitioner. That is just my advice, because I do think that it'll serve you better in the long run. When you have clinical experience as a nurse, a lot of your judgment, a lot of the things that you're going to do is going to serve you better, opposed to you fresh out of nursing school and have no clinical experience at all, and you're jumping into becoming a nurse practitioner. And I've seen a lot of nurses do that, and I don't think that's a good idea. My time spent working as a nurse for 7 years, it definitely helped me. My clinical experience that I got over that time definitely helped me in my clinicals when I went to school to become a nurse practitioner. A lot of my thought process once I became a nurse practitioner. I'm not saying you're not going to be a good NP if you don't have clinical experience, but I do think that it'll serve you better in the long run, because let's be honest, nursing school ain't really teaching us clinical stuff as nurses. Nursing school is just the vessel to bring you there, and then after that the floor is gonna teach you what you need to know. So that is it for me. You learned something. If you enjoyed this video, make sure you hit that subscribe button and click that notification bell so you don't miss out on any of my content. Thanks again for watching, and I'll catch you in my next one. Bye guys.